I'm Dr. Eric Tabor, the Medical Director for Northshore Dermatology. I've been in practice here on the North Shore for 23 years. I attended UC Berkeley for my undergraduate degree in physiology and anatomy. I graduated medical school in 1993 with honors from George Washington University in Washington, D.C. What initially attracted me to dermatology was the diversity of practice, the aesthetics, the surgery, and the medical aspects of dermatology I find very fascinating. When I'm not working, I enjoy spending time with my family and friends, obviously watching sporting events, Saints, racing, and just having a good time, going out to dinner and enjoying the time outside of the office. My favorite part about fatherhood is laughing with my kids. They never cease to amaze me or bring joy to my life. What sets Northshore Dermatology apart from other practices is our ability to offer a complete set of dermatologic needs for our patients, from urgent appointments to Mohs surgery to cosmetic procedures to the latest in lasers, to expert medical dermatology and surgical dermatology. We've found a way to cover all of our patients' dermatologic needs. My favorite technology right now is probably dermal fillers. Dermal fillers are a way to revolumize the skin, treat fine lines and wrinkles, help with just reversing some of the appearance of the aging process in patients. There are a variety of different fillers, and each one gives me a different tool in my tool bag to treat patients and their cosmetic concerns. I know we have new toxins coming, new neuromodulator toxins that will allow us to treat patients for either shorter, briefer periods so they can kind of get their feet wet and figure out whether or not they like the effect of the toxins, or for those patients who are maybe more experienced, giving them a longer, greater longevity in their toxin experience. My daily skincare regimen includes sunscreen, of course, and then evenings I like to use TNS Essential Serum and HA5 to keep the moisture balance in my skin. And then Lytera 2.0 is my go-to product for pigment correction. The one question patients ask me most is how to prevent aging, skin aging in particular. And I answer them that the most important part of their daily regimen is sunscreen. The one thing I wish that everyone knew about their skin and skincare regimens would have to be that preventative maintenance is the best approach to avoiding skin cancer, avoiding photoaging, and looking your best as long as possible. There are all different skin types and everybody ages at different rates, but the sun is not your friend, and protecting and starting at an early age and generating those behaviors, especially in our children, where they are aware and protective of their skin for the future. The importance of an annual skin check cannot be overrated. The skin is the body's largest organ, and we like to follow 5 simple rules when we're looking at a skin exam or really trying to evaluate a mole. One of the things I try and provide to my patients is the knowledge of the A, B, C's, D's, and E's. A stands for asymmetry, and if you take a mole and you divide it in half, one half should look like the other half. B is for borders. Moles should not look like islands. They should not be wavy. They should be nice and smooth and in their circumference. C is for color changes or variegations. Moles should be uniform in color, not particularly dark or not changing in color. Diameter of 6 millimeters is the D part of that equation, and we look at moles and expect them to be less than 6 millimeters or about the size of a pencil eraser. And then E is for evolving. Any mole that's evolving or changing needs to be evaluated by a professional. The other thing that I like to share with my patients is that any lesion that doesn't heal or that recurs or bleeds over a 6-week period of time probably should be further evaluated. So what I recommend that everyone do is do something special for themselves every day. Take a moment out, take a deep breath, and really try and enjoy the moment that you're in. I'm Dr. Eric Tabor, the Medical Director for Northshore Dermatology. I've been in practice here on the North Shore for 23 years.